Okay, today we're talking about valacyclovir. And I know, you might be thinking it's just another pill, but it's not. This is a seriously clever piece of bioengineering. It's basically a smarter, more targeted weapon designed to take down specific viruses from the inside out.
All right, so to really get our heads around valacyclovir, here's the game plan. We're going to look at why it's a smarter antiviral, then we'll dive into exactly how it takes down viruses. After that, we'll cover what it's used for, how it's dosed, and finally, the really important safety warnings you need to know.
So, first things first, what's the big deal? What makes valacyclovir such a significant upgrade from the drug that came before it? Well, the secret is all in its design. The whole strategy behind valacyclovir really hinges on this one concept. It's a prodrug. Think of it like a secret agent. It's inactive when it first enters your system. It's just waiting for a specific signal inside your body to activate and get to work. So when you take the pill, it's not actually in its final virus-fighting form. Not yet. And here's the payoff for that clever prodrug design. When you compare it to the older drug, acyclovir, valacyclovir has way higher bioavailability. In simple terms, that means your body absorbs it much, much more efficiently. So you get higher levels of the active, virus-fighting drug into your bloodstream. It's like getting more bang for your buck with every single dose. So once the drug is absorbed and activated in your body, how does it actually stop a virus dead in its tracks? This is where things get really, really clever. It basically works like a smart bomb. See, the active drug is drawn specifically to cells that are already infected with the virus. It knows exactly where the enemy is hiding, and it leaves your healthy cells almost completely alone. And that's absolutely crucial for an antiviral. You want to minimize collateral damage and reduce those side effects. Let's break down this four-step mission. First, the drug gets inside an infected cell. Then, and this is the most critical part, a specific viral enzyme flicks a switch, activating the drug. Your own healthy cells don't have this enzyme, so the drug just stays dormant in them. See how smart that is? Once it's active, the virus mistakes it for a building block and sticks it into its own DNA chain as it tries to copy itself. And then bam, checkmate. It terminates the chain, stopping viral replication cold. I mean, it's just a brilliant form of sabotage, isn't it? It uses the virus's own production line against it. By breaking that DNA chain, the drug basically pulls the plug on the virus's ability to make new copies of itself. The infection gets contained, which gives your own immune system the chance to come in and clean up the rest. Okay, so we know how it works its magic. Now let's look at the specific viral targets it's designed to go after. Valacyclovir is prescribed for infections caused by a few very common members of the herpes virus family. We're talking about things like shingles, which is that nasty reactivation of the chickenpox virus, genital herpes, where it can be used to treat outbreaks or even as a daily therapy to prevent them, and of course, common cold sores. Now, having a powerful tool is only half the battle. You have to know how to use it correctly, right? And for valacyclovir, getting the dose and the timing just right is absolutely essential for the best results. And as you can see here, one size definitely does not fit all. Look at this. The dose for shingles is completely different from the short, high-dose plan for a cold sore. And notice how a first-time genital herpes outbreak gets a 10-day treatment, but a repeat one only needs 3 days. Every single protocol is tailored to the specific situation. And with this drug, timing is pretty much everything. For shingles, for example, starting treatment within this 72-hour window is critical. It can make a huge difference in the severity of the rash and the risk of long-term pain. And that same idea applies to other things like cold sores. Starting at that very first sign, that real tingle or itch is key to getting the best result. But, beyond what's being treated, the single most important factor a doctor will consider is your kidney function. This is non-negotiable. The dose has to be carefully adjusted for anyone with kidney issues to stop the drug from building up to dangerous levels. So, let's talk about the other side of the coin. While valacyclovir is generally well tolerated, like any medication, it's not without risks. And knowing what to watch for is absolutely key. Yeah, it's really important to know the difference between what's common and what's a serious red flag. You might get some mild side effects, like a headache or an upset stomach, but the serious ones, things like signs of kidney trouble or neurological changes like confusion or agitation, those are rare, but they should be treated as an emergency. You need to get medical help right away. So, to use this medication safely, this is basically the checklist you need to go over with your doctor. They have to know about any kidney issues, any other drugs you're taking, and of course, any allergies to this family of medications. An open, honest conversation is the absolute best way to make sure the treatment helps, not harms. So, let's wrap this all up. Valacyclovir is a super effective, very cleverly designed prodrug that literally stops certain viruses from making copies of themselves. But because it's so powerful and so precise, it absolutely must be used under the supervision of a doctor who can pick the right dose and monitor you for safety. You know, the targeted smart bomb approach of valacyclovir was a huge leap forward. It really makes you wonder, what's next? As our understanding of how viruses work gets even deeper, how much more precise and effective can these treatments possibly get? It's a pretty fascinating question for the future of medicine.